The people who work in oncology, love their oncology patients. It's our specialty area. We chose it, and that's what we want to do.
Cancer services at Condell are different truly because of the caring staff.
Our physicians are very passionate about taking care of the patients and making sure that they know everything they need to know to make sure that this journey that they're on is as seamless as possible.
When it came to reality for me, the treatment plan really was to survive. My cancer was pretty advanced. I didn't have a lot of options.
My history with cancer started in 2003 with breast cancer, followed in 2007 with ovarian cancer, where I felt like I was hit with an 18-wheeler. I just broke down in tears and I said, I can't do this. 3 nurses were there in the room immediately telling me, you are going to get through today. You can do this.
Here at Condell, we treat every patient as if they were our own family. So when they come here, they can feel that. They feel the love, they feel the support.
We became a family. First name basis, they would check on him all the time. They took care of him, no matter what it was that he wanted or needed. He likened it to being in a hotel. That's the kind of service that he got, with a concierge.
What makes it really, really special is that these nurses really pride themselves in coming in and making sure that they have that one-on-one with that same patient every time. So they get the same patient every single time, which has made it such a bond between the patient and the nurse.
I probably had in excess of 20 hospitalizations in the last 15 months. And knowing that Sharon, who's the nurse on C2, is going to be there to take care of me is a huge relief. I don't have to go through when I was diagnosed, how do I feel, what's my emotional state of mind. You just feel like you're walking into a family setting.
I'm going to take care of her, and I'll see her through to everything she goes through. As long as I'm here, I'll make sure that she gets everything she needs.
I really don't know a better way than to describe it than it's like coming home to a relative that you don't see often, but that you care deeply about and that you know cares deeply about you while you're visiting.
You know, when you come in with an illness, the physicians do what they need to do, provide the medication and the treatment plan, but it goes one step further. You have to have also the prayer, the hope, the encouragement.
Getting better is not just prescribing the right medicines, making the right diagnosis, and doing the right tests. It is looking at the whole person, looking at nutrition, looking at the social issues that are involved in managing an illness like cancer. That makes a major difference.
I got into it today.
Dr. Slivnik started a support group for ovarian patients to share ideas.
I mean, as great as the nurses are, they haven't had cancer. They don't know what it's like to walk in my shoes. Carol and all the other members of the support group have been there. They know what it's like. They've experienced all the things that I'm experiencing. And so there's just that sense of peace, and there's that sense of camaraderie that only comes from being with people that really do walk in your shoes.
A lot of it is sharing ideas, sharing tips, how they got through, whether it's nausea, whether it's improving your diet. We talk about all kinds of subjects.
I count on them to do things that I can't do, to answer questions for the other members in the group that I can't answer.
It gives people that feeling that they're not alone in their battle. And I think seeing that there's others that have made the battle and made it successfully, I think that helps patients.
Emotional support is incredibly important to the care of our cancer patients, and we believe in that and practice that on our unit all the time.
We're going to help you get through this battle, but we're going to do it with a whole different host of resources that we have available.
Oh, you look good. Thank you. You look good too. But then you're the healthy one, right?
What's missing from me, in my experience, is someone that can coordinate care, someone that can tell you, this is the normal treatment plan. This is how we get in touch with this person. These are resources in your community.
And then I'll be following you periodically. I'll call you and see how you're doing with your treatment.
The nurse navigator serves as the glue to hold it all together.
Someone to help them navigate through this system to get them their appointments at one institution in a timely manner so their treatment can start, and even hook them up with some emotional support, give them direction to support groups and other resources, help with insurance concerns. It's like having your best friend with you through this tough time.
They can empower the patient to know that this isn't necessarily a death sentence, and that there are so many things that we can do to help you get through this. Because when you have that diagnosis, you do feel like you've lost control of your whole life.
They gave their hearts, they gave their souls, and that's important to somebody who's in a life or death situation.
Where would we have to go to get these great services if Condell didn't provide them?
This is the most rewarding job in the world, to take care of these patients.